I will be giving a short presentation on the use of CD19 CAR T-cells, anti-CD19 CAR T-cells in adults. It'll be a short presentation. It's an enormous topic. The idea of CAR T-cells has been around for 20 years now, but it was really some technological advances that led to them being really rather dramatically effective for CD19 positive malignancies. When we think about CD19 positive diseases, we think about lymphoblastic leukemias and lymphomas primarily. CD19 positive CAR T cells have been dramatically effective and are now FDA approved to treat ALL. ALL tends to be more of a pediatric disease, and the approval using CAR T cells for ALL is really only in children and young adults up to age 25. Certainly people up to age 25 or adults, CAR T cells have resulted in really unprecedented long-term remission rates in young adults with ALL. The probably more frequent use in adults of anti-CD19 positive CAR T cells is in lymphomas and CLL. At the University of Pennsylvania, we began our program 10 years ago treating patients with CLL. In fact, those were the patients included in our first clinical trials. We've published several articles on that experience. Further studies have been using CAR T cells in patients with non-Hodgkin's lymphoma, and in fact, there were 2 trials that have led to FDA approval of CAR T cells against CD19 positive aggressive non-Hodgkin's lymphoma. There are 2 FDA-approved products, Tisagenlecleucel and Axicabtagene ciloleucel. Both are FDA-approved for aggressive B-cell lymphomas. They've shown really rather remarkable response rates in patients who have largely failed most conventional treatments. I think even more exciting is that many of the remissions are sustained for long periods of time. In these patients, we often see early relapses, particularly after chemotherapy in patients who have refractory diseases. Most of the patients who relapse in the first 6 to 12 months, yet there are patients now that have been followed beyond 5, 7, 8 years still in remission with a very high likelihood, in fact, that they've been cured. So CAR T cells are a completely new paradigm, a new approach to treating refractory lymphomas in patients who have been heavily pretreated, who have few, if any, conventional treatment options, and may be curing many of these patients. I think the biggest limitation in lymphomas and in CAR T cells in general, outside of ALL, is that not enough patients actually achieve remission. Those patients who achieve remission tend to have sustained responses. And so the trick now is to figure out how to get more patients to respond. There's a great deal of activity in the field being directed toward making better CAR T cell products, making them more effective, making them safer, in fact. And trying to use them so that response rates will be higher and more patients can benefit. Some of the exciting approaches now are, in fact, combining CAR T cells with other therapies, such as some of the studies that we and others have done combining CAR T cells with ibrutinib that seem to show response rates may in fact be higher and deeper, particularly in patients with CLL. So there's a lot of activity, I think, that we will learn about over the next several years where CAR T cells become even more effective and they become safer and will be applied to more and more adults, in fact, with CD19 positive malignancies.